But you can't talk about community health without talking about the healthcare workforce. Right now, it's estimated that the uninsured get somewhere around 60% of the services that the insured get. How does that happen? Where are the uninsured going for services? Community health centers, about Holy Cross. How many people are uninsured there? Yeah. So they're going to the hospitals, they're going to the community health centers already, they're getting about 60% of the services that the insured are getting. So when you make the uninsured insured, which is one of the main goals of the law, how are you going to have the workforce to meet those needs? That other 40%. Those are major questions. In New Mexico, we have particularly major questions because 32 out of 33 counties in New Mexico have a healthcare workforce shortage, and New Mexico ranks last when it comes to access to care and the use of preventative care nationally. As you all know, people in the field know, we have major healthcare challenges. So what is the response or reform? I think it's very important for most of you to realize that Senator Bingaman wrote many of the healthcare workforce provisions that are in the law. We actually had a bill that was called the Health Access and Supply Professions Act. It was out a couple years ago that dealt with rural and underserved communities and making sure that they have enough healthcare workforce provided in those communities. How many of our communities are rural and underserved? Like 99%, right? There's a reason, that we made sure that we provided, specific provisions that we're going to deal with rural and underserved communities. Senator Bingaman wrote that law. Senator Reed said that was an outstanding law. We want to make that a nationwide model. We're going to take a lot of that language and we're going to plug it into healthcare reform. That's hugely beneficial because we obviously drafted those workforce provisions with New Mexico in mind. So what is this law? What are the provisions that are going to expand doctors, mid-level practitioners, nurses, PTs? Well, the first thing is this law is going to create a federal healthcare workforce commission. Most people figured we already had this commission. We don't. Without this law, we didn't have a commission to understand why do we have workforce issues. So if this commission comes to New Mexico and says, all right, New Mexican citizens, why do we have workforce issues here, healthcare workforce issues here in New Mexico? What are some of the things you would say? Why do we not have enough doctors, mid-level practitioners, providers? Rural. What other? Come on, you guys are all in the field. What's going on? Why can't you get enough people? No dental school. That's big, right? Can't have enough dentists if you don't, have a dental school, and it's not likely that other dentists are going to be trained in other states and come into New Mexico.
Specialist docs get paid more in primary care.
Right. In the United States, specialists actually are about 70% of the workforce. Primary care is about 30% of the workforce. That's the inverse internationally. It's about 70% primary care, 30% specialists throughout the rest of the world. That's a big issue. Where's our med school? Albuquerque. How many med schools do we have? Does it have enough seats to put out enough students? Those are the kind of critical questions that this workforce is going to come up with and say, here's some of the things that we're seeing. Are the reimbursement rates too low? Are the quality of life in some rural communities not meeting the needs of doctors or mid-level practitioners? What are some of the challenges that New Mexico has? Let's actually list all that out and come up with some concrete solutions. That's one of the things the law does. The other thing the law does is provide $1.5 billion to the National Health Service Corps that's going to send 15,000 new workers into rural and underserved communities here in New Mexico. This is major for New Mexico. The other thing it's going to do is increase loan assistance for new and current primary care providers. So if you know current primary care providers, tell them about this provision. Say you may be able to take advantage of some of this, loan assistance and federal government helping you pay off your loans if you stay in primary care. It's also going to increase the payments to primary care docs in Medicaid and rural doctors, including surgeons in Medicare. I go over to Clayton a lot. They've had a heck of a time trying to keep a surgeon in their hospital over there. I think they just now got it, and I'm hoping that that surgeon is all settled in. But they were having trouble for years in terms of keeping a surgeon there. And if you have a community that's pretty far and remote from a lot of other communities and you have no surgeon, you could be in some deep trouble in terms of people who are going to that hospital and may need immediate emergency basic kind of surgeries.